Its name is diabetes. Whether genetic or non-genetic, it makes life difficult for a person with diabetes, so that the affected person must constantly take medicine and watch his blood sugar level. He must pay attention to his feet so that he does not get injured and observe many other issues. Still, sometimes people with diabetes make mistakes in eating, taking care of their body, taking medicines, and etc., which are harmful to their health. In this video, we review 8 common mistakes made by diabetes. Number 1. They say that diabetics should avoid sweetmeats and chocolate for the rest of their lives. There is no doubt that these types of foods raise blood sugar, but diabetics can eat these foods while following a proper diet with the help of a nutritionist. There is nothing wrong with consuming simple sugars such as sweetmeats and chocolate, as long as it does not provide more than 10% of the patient's total daily energy. That means, for example, you can eat 1 piece of cookie instead of a palm of bread during the day and not eat that palm of bread again that day. Number 2. Some people think that the leading cause of diabetes is excessive sugar consumption. No, the leading cause of diabetes is a lack of insulin hormone in type 1 diabetes, and obesity and body resistance to insulin hormone in type 2 diabetes. Of course, being overweight and having a positive family history increase the probability of type 2 diabetes. Number 3. Many people think that anyone whose father or mother has diabetes will surely get diabetes. Although genetics plays a role in developing diabetes, especially type 2 diabetes, it should not be concluded that anyone whose parents have diabetes will indeed develop diabetes themselves. At most, we can say that the probability of diabetes, primarily type 2 diabetes, is higher in such people, and they should be more careful about their diet. Number 4. Some say that diabetics should only eat diet and diabetic foods. It is not like this. Most diet foods available in the market are not highly regarded and trusted by experts. The diet of diabetics should only be healthy and calculated, low-fat, balanced in sugar and salt consumption, and with particular attention to legumes, vegetables, and fruits. Just because you have diabetes, your diet plan does not need to be different from a non-diabetic person. According to experts, it is a common mistake to exclude food from the diet plan of diabetics. The diet of diabetics should be balanced and varied. This means that it includes proteins 15% of total calories, glycosides 50 to 55, and lipids 30 to 35. The primary point is that, as a person with diabetes, you should reduce the consumption of fast-absorbing carbohydrates, glycosides such as sweet food products, because these foods raise blood sugar very quickly. Note that having 3 meals a day and reducing the number of calories you eat at night if you are overweight are among the principles of proper diabetic nutrition. Number 5. Some people with diabetes do not recognize their medications correctly. They think that if they inject insulin or take anti-diabetic pills, there is no need to take the diet seriously. To treat diabetes, in addition to following a diet, exercise and physical activities are needed, and sometimes the use of anti-diabetic pills or insulin injections is also required. And none of these should be excluded from the treatment set. If you have diabetes, you need to know the medicines and the effect of each one. Most diabetics are not careful about the correct way to use them, without understanding the role of medications. According to the experts, the patient should carefully monitor his treatment, be able to take the drugs compelling in regulating his blood sugar correctly, and know more about drug disorders. In addition, as a diabetic patient, you should prepare a list of all the medications you take for diabetes, blood pressure, and cholesterol. This is to avoid drug interactions and side effects of simultaneous use of some drugs. For example, non-steroidal anti-inflammatory drugs such as ibuprofen may cause severe damage to the kidneys of a diabetic patient. When you visit a pharmacist, general practitioner, cardiologist, etc., give him a list of your medications so that he is fully aware of your treatment. Ask your doctor about prescription drugs and take them, knowing their use and possible side effects. Number 6. Some people with diabetes think they can realize their sugar is high or low. No, the symptoms of high blood sugar and low blood sugar are so similar that there is usually no way to distinguish between the two except by giving a blood sugar test. Or some of them act on their own. Do you think that medicine is not suitable for you? Does your neighbor or friend consider your therapy inappropriate and dangerous? Maybe you are right, but you should not stop the medicine at your own discretion or the order of those around you. Diabetic drugs should be checked regularly, and their amount should be increased or decreased if necessary. Be sure to keep in touch with your doctor and consult him about continuing or stopping your medications. They go to the bathroom a lot. In general, it is not recommended for people with diabetes to wash their bodies a lot. Of course, we do not mean daily short showers. We suggest extreme washing of the body in the bathroom every day, because this increases the risk of fungal disease mycosis in diabetic patients. In addition, you should avoid using very strong soaps that cause mycosis causing fungi to spread, and use neutral or slightly greasy and colorless soaps. You should pay attention to the hygiene of your feet and be sensitive to scratches or wounds. They do not walk. If you have diabetes, walk for 30 minutes every day. It doesn't matter what level your disease is in or how old you are. Working on muscles and strengthening them is one of the best ways to improve insulin use. Undoubtedly, we do not mean running for several hours. Experts recommend having suitable and light physical activity such as walking daily or every other day. Sugar is considered the main culprit. Most people think diabetes occurs because of high sugar consumption, but this belief is wrong. Diabetes occurs first of all due to consuming too many calories, being sedentary, and staying at home. If your physical activity is low, you are a housewife or sit behind a desk, and you rarely walk a few steps, it is better to think more about your health. Number 7. Say that insulin causes impotence. Of course, some diabetic men have impotence, not because of insulin injections, but because of the neurological complications caused by diabetes in the long term and, of course, if the disease is not controlled. Number 8. They say that insulin is addictive. This belief is also completely wrong. Insulin is a natural body hormone and is not addictive at all. Fortunately, the injection tool is becoming more advanced day by day and makes the injection more accessible and more uncomplicated. Enjoy this video. Hit the like button and subscribe to our channel for more videos like this. Thanks for watching.